Hello, this is Danny Blyth from the College of Integrated Chinese Medicine talking about entry and exit points. This is for acupuncture students only, and please pause and read this. So the 12 main channels are connected to form a complete circuit, and this is a way of clearing blocks through the channels or clearing blocks between the channels. And the channels run in the same order as the 24-hour clock, which came later in history. And it looks like that, running through from the lungs around through the 12 organs, liver, and back to the lungs again. So the entry and exit points are located at the beginning and end of the channels or near to. So this circulation starts in the lung. The entry point of the lung is lung 1. That travels down the channel and exits at lung 7, which connects to large intestine 4. Travels down the channel to up the channel to large intestine 20. Large intestine 20 connects to the stomach at stomach 1. This continues around to make a full circle around all of the channels until it reaches the liver, liver 1, liver 14, and that connects back into lung 1 and completes the circuit. So some of these points are not the last point in the channel. It wouldn't be very easy for lung 11 to connect with large intestine 1 because it has to go right around. Consequently, lung 7 connects with large intestine 4 to solve this problem. The same with the stomach, so stomach 42 connects with spleen 1. The same with the pericardium. Pericardium 8 connects with triple burner 1. And the same with gallbladder, so gallbladder 41 connects with liver 1. This leaves us two that are a little bit different. Now, kidney 23 onwards sometimes get called the chest shoe points, and they're somewhat different in that they all affect very strongly the spirit. So kidney 22 could in some ways be thought of as the last point on the kidney channel. And triple burner is something of an anomaly, as it always seems to be, in that its exit point is triple burner 22, though sometimes people do use 23. Likewise, the exit point for the small intestine is small intestine 19, but in the Ling Shu where these are kind of hinted at, it seems like 18 is probably more suitable and sometimes gets used instead. Pericardium 1 is not easy to needle in a lot of women, so pericardium 2 does a perfectly good job. So this suggests that these entry and exit points are not kind of written in stone, but they are ways of clearing the channels out. So we can use these to clear a block between the channels. So we might needle liver 14 and lung 1 to clear a block between the liver and the lung channel. We can also use them to clear through a blocked channel. So we might use heart 1 and heart 9 to clear through the heart channel. So rather like a log blocking a stream, what we tend to see is a excess building up in front of the block and a relative deficiency after the block. So if we think of a liver-lung block, we tend to get a relative fullness in the liver and a relative deficiency in the lung. So this might be a deficiency, or it might be a thinness. We also often see a quality that spreads from two consecutive channels. And this pulse difference often doesn't change with normal treatment when we would expect it to, or the pulse change doesn't hold. We also get symptoms around the points, so you'll notice that a lot of these channels cross over in the head, and a lot of them cross over in the chest, and you often get symptoms relating to those areas. You can also get a pulse that doesn't change with normal treatment. Everything else about the pulse changes, but this block doesn't, or the pulse changes but doesn't hold. You cannot get the results you expect from treatment. You can get a treatment relapse, or the treatment just stops working. So often you've increased somebody's qi and the chi increases until the point where it creates a block. So this can be something that comes along not at the beginning of treatment but during treatment. You often see symptoms around two elements as well. So for example, in our liver-lung lock we might get colour, sound, emotion, odour of wood and colour, sound, emotion, odour of metal. Or we may get symptoms in the liver and symptoms in the lung. To clear a block between channels, you treat the exit point first and then the following entry point. So if we had a kidney pericardium block and both pulses were deficient, we would bilaterally tonify without retention, kidney 22, and then bilaterally tonify without retention, pericardium 1 if it was a man, or pericardium 2 if we couldn't needle pericardium 1. To treat a liver-lung block where the pulse is full on the liver, deficient on the lung, we would sedate liver 14 bilaterally, and then we would tonify lung 1 bilaterally. If both pulses are full, then you sedate both pulses, but this is very unusual. Sometimes you need to track back or move forwards to clear the block through more of the channels. If you have to chase it back too far, then suspect that actually you haven't got a block at all. To clear through a channel, you treat the entry point and then the following exit point with appropriate needle technique. So to clear the lung channel, you would needle lungs 1 and lung 7. To clear the stomach channel, stomach 1 and stomach 42. And this can be done on its own or with local or Asha points for treating pain or symptoms in the channel itself. So I'll discuss this in the order of how common I see them in the clinic. So triple burner gallbladder I think is very common because this is the channels where lingering pathogens get stuck. And this is the pulse picture. You can just see triple burner point in there. You can get jaw problems, TMJ, teeth grinding, facial problems, facial paralysis, post-stroke, trigeminal neuralgia. You can get headaches around the temples. You can get problems with the eyes. I've seen this with somebody with a puffy eye, seen this with temporal headaches, seen this with facial paralysis following a stroke. Liver and lung. Here's your pulse problems with the rib cage, costochondritis, tightness in the flank or ribs, in the diaphragm, so shallow breathing, sighing, stress-related asthma. Seen this can affect the breasts in women, so lumps, cysts, tenderness, can affect the chest area. Often find tension in the throat with this, and one patient described a straitjacket of emotion that released after removing this block. Large intestine and stomach, you can see sinus problems, chronic sinusitis, sinus pain. Obviously you've got the maxillary sinuses behind here. Facial problems, facial pain, swelling. Seen this with a patient who has chronic water retention, who's on dialysis and gets this block a lot. Visual problems. It can make you blocked and muzzy. Remember, this pulse picture I'm giving you here is actually a gradient. So this might be a deficient pulse and a more deficient pulse, or it might be a deficient pulse and a thinner pulse. So the plus and minus represent a gradient and not absolutes. Or you might get a quality that just continues through the two pulses. So kidney pericardium, get chest problems, palpitations, shortness of breath, breathing problems, chest pains, anxiety, and breast problems. Spleen and heart, flank and chest pains. Often see this with anxiety, chest pains, panic attacks, insomnia. Remember, with all of these you can get local pain in the area and look at the area to see if you get any changes of skin, any rashes, any superficial signs of a blockage. Small intestine and bladder, this is the pulse. You can get ear problems, tinnitus, poor hearing, chronic ear infections, ear pain, facial problems, trigeminal neuralgia, sinus problems, facial pain, visual problems, obviously bladder 1 ending in the eye. You've also got the frontal and ethmoid sinuses here, so you can get sinus problems, blocked sinuses, chronic sinus infection. Seen this a lot in trigeminal neuralgia, but also a herpetic attack. Compared to blocks on the face and the chest, hand and foot I've seen a lot less. I don't know if that's me or if that's universal. Have treated lung large intestine block for de Quervain's syndrome quite a few times, and used some of the others for local problems. It's also worth pointing out that a block between a yin-yang pair of organs is normally detected as a split pulse and normally treated with the low points rather than entry-exit points, and this is something for later. So entry-exit points are included in the oral tradition of several different systems, but they're not included in any classical texts. Ling Shu Ten explains the circulation of qi generally, and it talks about where the points are not the last point. It describes the channels with the exception of the kidney, and I'd recommend you to in the footsteps of the Yellow Emperor if you want to learn more about this. So Ling Shu 16 discusses the circulation of the yin qi from the lung all through its circuits and back to the lung again. So the essence, which is condensed, moves to the channel passages. It constantly cycles without end. It ends and then returns to the beginning. This is called heaven and earth's cycling. So as I said, this is part of an oral tradition, but here are some further reading and some source texts, and also thanks to Andrew Prescott, who is writing on some forums, helped to clarify some of my thinking.